Poor circulation, memory loss, and even heart failure. All of them can begin with something as overlooked as a dry mouth when you wake up. Most people roll over, grab a glass of water, and get on with their morning. But what if that dryness has nothing to do with thirst? What if it's your body sending you a warning it's been sending for months, maybe years, and nobody taught you how to read it? Here's what stops me in my tracks every time I think about it. Chronic morning dry mouth affects nearly 1 in 3 adults over the age of 60. And in the overwhelming majority of cases, it has absolutely nothing to do with how much water you drink the night before. Nothing. And yet, this is not a conversation happening in most pharmacies. It is not a conversation happening at most annual checkups. It is simply not being had. Stay with me through to the end because the number one cause I'm going to share with you today is something sitting quietly in your medicine cabinet or on your nightstand right now. And it may be doing far more damage than simply drying out your mouth. We're talking about something with the potential to affect your kidneys, your heart, and your brain simultaneously. I'm Dr. Freya Parker, a physician with over 10 years of dedicated clinical experience focused on the health of adults over 60. In that time, I've sat across from countless men and women who came to me with something that sounded minor, only for us to uncover a serious underlying condition that had been hiding behind that one small dismissed symptom. Morning dry mouth is exactly that kind of symptom, deceptively simple on the surface, potentially life-changing underneath. What I'm about to walk you through challenges something most of us have been quietly conditioned to accept, that aging means discomfort, that a dry mouth is just what getting older feels like. I want to be direct with you. That is not the complete truth. And after 10 years of watching patients suffer unnecessarily because this information never reached them, I'm not willing to stay quiet about it any longer. If this is useful to you, hit that like button right now. It helps this reach the people who genuinely need it. Let's talk about what is actually happening inside your body on those mornings when you wake up feeling like your mouth is made of cotton. Your mouth depends on a continuous supply of saliva, and saliva is not simply water. It is a sophisticated biological fluid carrying enzymes, antimicrobial proteins, minerals, and protective compounds that defend your teeth, your gums, your throat, your digestion, and your immune system around the clock. When salivary glands begin to slow down, or when other systems in the body start to struggle, saliva production falls. And when it falls significantly, your mouth dries out, especially overnight when you are not drinking, not speaking, and not doing anything to stimulate saliva flow naturally. After the age of 60, your body already produces roughly 30 to 40% less saliva than it did in your 40 seconds. That reduction alone creates real vulnerability, but it becomes genuinely dangerous when it combines with the 7 causes I'm about to reveal, because none of these causes simply dry out your mouth. Every single one of them is pointing to something deeper happening inside your body. Here is what concerns me most as a clinician. Chronic dry mouth is associated with a 45% higher risk of systemic infection in adults over 60. Saliva is your mouth's frontline immune defense. Remove it, and bacteria, fungi, and viruses gain a direct path into your bloodstream. So, let's go through all 7 from the least serious to the one that worries me most. And by the time we finish, you will know exactly what to watch for, what to say to your doctor, and what you can do differently starting tonight. Before we begin, I want to ask you something personal. How long have you been waking up with a dry mouth? A few weeks? Several months? Years? Leave your answer in the comments below. I read every single one, and your answer helps someone else watching this realize they are not alone. Number 7 on our list is the most common cause I see, and also the most dismissed: mouth breathing during sleep. Before you move past this one thinking it's obvious or harmless, I need you to hear something important. Mouth breathing during sleep is almost never just a habit. In my clinical experience, it is nearly always a symptom of something else going on, and that distinction matters enormously. When you breathe through your mouth at night, air moves directly across your tongue, your palate, and the back of your throat. That constant airflow evaporates moisture at a rate your salivary glands simply cannot keep pace with while you sleep. The result is that sandpaper feeling when you wake up. Cracked lips, a thick or coated tongue, sometimes a sore throat that has nothing to do with any illness. But here is the part that concerns me far beyond the dry mouth itself. Mouth breathing during sleep is frequently driven by nasal congestion, a deviated septum, nasal polyp, or sleep apnea. And sleep apnea in particular is not something to wave away. Research shows that untreated sleep apnea is linked to a 60% increased risk of stroke and a 40% increased risk of heart failure. If you are waking up dry-mouthed and you also snore, feel unrested after a full night's sleep, or if someone close to you has noticed you sometimes stop breathing during the night, please do not file that away as just the way you sleep. Speak with your doctor about a sleep study. That single conversation could matter more than you know. For those whose mouth breathing is not connected to sleep apnea, the practical solutions are straightforward and effective. A nasal strip worn across the bridge of your nose before bed can increase nasal airflow significantly, encouraging your body to breathe the way it was designed to. A humidifier in your bedroom set between 40 and 50% humidity reduces overnight moisture loss dramatically. Switching to a side sleeping position reduces the tendency to breathe through your mouth. And a small strip of surgical tape placed vertically over the lips before sleep, something sleeps have used for years, gently trains mouth breathers back toward nasal breathing. Many people notice a real difference within the first week. Number 6 is the mistake I see most consistently, and it is one that feels completely logical until you understand why it does not work. Most people who wake up with a dry mouth assume the fix is simple: drink more water before bed. So, they do exactly that. They finish a large glass right before they turn the light off, and they wake up just as dry as before, sometimes even more frustrated because they did everything right and nothing changed. Here is why. Your body does not hydrate in real time. When you drink water, it takes between 30 minutes and 2 hours for that fluid to be absorbed, distributed to your tissues, and made available for functions like saliva production. Water consumed at 10 o'clock at night is doing very little for your mouth at 6 o'clock the next morning. The window has already closed. The real problem is what happened or didn't happen in the afternoon. Research found that adults over 60 who did not maintain adequate fluid intake between noon and 4 in the afternoon were 62% more likely to experience significant overnight dry mouth compared to those who stayed consistently hydrated throughout the day. 62%. That is not a small difference. And after 60, this becomes harder to manage naturally because the body's thirst mechanism becomes genuinely less reliable with age. You can be meaningfully dehydrated and feel no particular urge to drink. Many people also quietly reduce afternoon fluids to avoid nighttime bathroom trips, which is completely understandable, but it creates a hydration deficit that peaks precisely when you have no way to correct it. The solution is not more water at night. It is front-loading hydration earlier. Aim for 6 to 8 ounces with every meal and every afternoon snack. And here's a small but effective pro tip. Add a pinch of sea salt and a squeeze of lemon to your afternoon water. This supports electrolyte balance, helping your cells actually hold on to the fluid you consume rather than letting it pass straight through. Number 5 is one that catches almost everyone off guard because we rarely think about nutrition as a direct cause of something happening in your mouth every single morning. Your salivary glands are not passive structures. They are metabolically active tissues that require specific nutrients to function properly at the cellular level, and 2 particular deficiencies tear through salivary gland function in adults over 60 faster than almost anything else. The first is vitamin A. This nutrient is essential for maintaining the health and integrity of every mucous membrane in your body, including the lining of your mouth, your throat, your nasal passages, and your digestive tract. When vitamin A levels fall, those membranes become thinner, drier, and progressively less functional. Research found that adults over 60 with low vitamin A levels showed a 41% reduction in resting saliva production compared to those with adequate levels. That is not a subtle effect. That is your salivary glands running on a fraction of their capacity. The second is the B vitamins, specifically B3 known as niacin and B12. Niacin deficiency directly disrupts the nervous system signals that trigger saliva production in the first place. B12 deficiency causes the tongue to become inflamed, abnormally smooth, and persistently dry, a condition called glossitis. Together, they create a dry mouth that no amount of water will fully resolve because the problem is not hydration, it is cellular function. After 60, B12 absorption drops significantly due to reduced stomach acid production, and research suggests up to 30% of older adults have inadequate B12 levels without any awareness of it whatsoever. For dietary sources, focus on sweet potatoes, dark leafy greens, and eggs for vitamin A, and lean meats, fish, and dairy for B12. For many adults over 60, supplementation is also necessary. Look for a B complex containing at least 1,000 micrograms of B12 in methylcobalamin form, the most bioavailable version available. And one practical pro tip: vitamin A is fat-soluble, meaning it absorbs far more effectively when consumed alongside a small amount of healthy fat. A drizzle of olive oil or a few slices of avocado with your meal makes a genuine difference. Number 4 is the combination I take most seriously in my practice. And if this one applies to you, I want you to hear it clearly. Not with fear, but with the understanding that knowing early is everything. If you are waking up with a dry mouth and you are also getting up to urinate more than once during the night, that pairing is a clinical warning flag I do not ignore. Together, those two symptoms are among the earliest signs of uncontrolled blood sugar and, in some cases, undiagnosed type 2 diabetes. Here is the mechanism. When blood sugar climbs above a certain threshold, the kidneys work overtime to filter and excrete the excess glucose. To do that, they pull water from the body's tissues. That internal fluid loss dehydrates you from the inside out, and one of the first places you feel it is in your mouth overnight when there is nothing you can do to compensate. What makes this so important is the timeline. Research found that morning dry mouth was reported by 63% of adults newly diagnosed with type 2 diabetes, and that most of them had been experiencing that symptom for over a year before their diagnosis, over a year of their body signaling something was wrong every single morning. I think of a patient of mine, a retired woman in her early 70s, sharp and active, who came in about something else entirely. She mentioned the dry mouth almost as an afterthought as she was leaving. I asked a few targeted questions. Was she waking at night to use the bathroom? Yes, regularly. Unusual afternoon fatigue? Yes. I ordered a fasting blood glucose panel that same week. Her result came back at 148 milligrams per deciliter. She had type 2 diabetes and had been living with it unknowingly for well over a year. Within 4 months of targeted dietary changes, daily movement and supplementation with berberine and magnesium glycinate, her fasting glucose had normalized. She told me at her follow-up, "I finally feel like my body is working with me again." That is what catching something early looks like. It's not a crisis, it's an opportunity. Number 3 is a condition that affects approximately 4 million Americans. And yet, the average patient waits nearly 3 years from the moment their symptoms begin to the moment they finally receive a diagnosis. 3 years. That is not a gap in medicine. That is a gap in the conversations happening inside examination rooms. The condition is called Sjogren's syndrome. It is an autoimmune disorder in which the immune system mistakenly targets the body's own moisture-producing glands, primarily the salivary glands and the tear glands. The result is persistent dry mouth, chronic dry eyes, difficulty swallowing, and in more advanced cases, systemic involvement, including joint pain, fatigue, and effects on the kidneys and lungs. Women over 60 are disproportionately affected, representing nearly 90% of diagnosed cases. So why does it take so long to identify? Because each symptom gets treated in isolation. The dry mouth gets dismissed as aging or dehydration. The dry eyes get attributed to screen time or seasonal allergies. The joint pain gets labeled as arthritis. No single doctor connects the dots. And the underlying autoimmune process continues unchecked the entire time. The diagnostic clue I want you to carry with you is this. If your dry mouth is consistently accompanied by eyes that feel dry, gritty, or burning, and particularly if you are a woman over 60, please ask your doctor specifically about Sjogren's syndrome by name. A.